For you, sir, and I would like to welcome you all for the session, and I'm handing over to Anisha ma'am to introduce our faculty. Ma'am, over to you.
Good afternoon, everyone. This is Anusha. I'm the facilitator for today's session. So today our topic is care of bedridden patients. Our speaker, Mr. Sajan, he is a senior nursing officer. He has a 10 years experience in palliative care, and he serves as a section head, infection control and prevention, ensuring clinical safety and excellence in healthcare delivery. He has completed his advanced CCPN course from Palam India and the Global Interprofessional Palliative Care Fellowship from University of Iowa. He has undergone specialized nursing training from Palam India, enhancing his experience in holistic and patient-centered care. He has also faculty member for on-site and online training programs for doctors and nurses, actively contributing to knowledge sharing and capacity building in palliative care. Welcome, sir. Welcome for this session.
Okay, once again, thank you. Once again, good evening to all. So today I would like to not introducing a new topic, but majority of the as a medical professional, basically we are all nurses. We are all know all about the total nursing practices, all those things. Basically, in academic session, majority of we are all studied all the care, which are all things needed to give mainly for the bedridden patient or total head to toe all care. We are all studied and we are all practicing also. In nursing foundation already we studied, and in our workplace also we are all practicing. But in this session, actually some more deep I will go, but majority of the things needed for the palliative care patient, because in palliative care majority of the patients are all maybe bedridden or dependent type of patient, or majority of them need support for taking care about themselves. So our support and our care is very much needed for all those people. So today we would like to introduce this topic. So actually, why we need to take care about this type of bedridden patient or bed-bound patient? So we can call it as a principle, or otherwise, because of these reasons, we going to take care about this type of bedridden patient. So in our palliative care, most of all, we are all taking care and we are giving maximum giving comfort to the patient. In curative side, we maybe nothing we can do, or some limitations are there for to do as a curative side. But maximum things, all of things we can do in the side of care and maximum giving comfort. So our main principle or main aim to prevent health complication. Already they are having some health conditions. Because of that, they are having some of the sufferings. So we are all making comfort and care them, but maximum we can prevent further health complication. Then maximum comfort we can promote to them. Then according to that, promoting comfort and prevention of health complication, maximum improving the quality of life or maintaining the quality of life. In that way, they are also feeling the confidence while during their lifespan. Then they are feeling of well-being or feeling of being a member in the family or member in the society. So their feeling of isolation, that feeling will not be there. We can prevent the feeling of isolation. Then our main aim, improving the quality of life, or at least maintain the quality of life of the patient. So these are all the basic needs of a patient. As a person, just imagine about us. We are all human beings. As a, for in social studies itself, we already studied basic needs of a person. Maybe food, water, shelter. All those things are the basic needs of a person. But once a patient becoming in bed bound stage or maximum dependent stage, their basic needs are limited in this way because their world is very much limited. They can't mobilize. Their limitation may be according to the mobility restricted because of their weakness or maybe from family side. They are all limiting their movements inside the house, then inside the room, then inside or on the bed and on completely on the bed. So their world is very much limited. So their basic needs are head to toe, total their physical needs are their basic needs. So today we going to discuss about all these things. We will cover some of the majority needed items we will cover, not much in procedure and a total technique or and all those things. So in oral care, actually oral care we can call it as a overall health because in oral cavity itself, maximum we can prevent some of the further complications or further infection, other sufferings. All things we can prevent from the oral cavity itself because oral cavity actually our main purpose why we going to take care about this oral cavity of the patient. First of all, we are all can consider mouth is an excellent incubator for the growth of bacteria because food particles, if after taking food they are not at all washing their mouth or not at all taking care about the mouth means food particles will be there inside the mouth, in between the gums, in between the teeth and underside of the tongue, wherever it is accumulating. Naturally the bacterial growth it will happen inside the mouth. So mouth is considering as the excellent incubator for the growth of bacteria. So we are all taking care about the oral cavity because we need to do hygienic practice. According to that, we can help them to maintain healthy status of the not only total oral cavity means it's containing mouth, teeth, gums, and lips, all things we can take care. So in all the way we can give comfort and we can prevent further complication. So in through the oral care we can prevent the dryness and the further mucosal infection or dryness and other even pain and other discomfort also we can prevent by giving proper oral care. So if one person is doing brushing means not only removing the food particle or not only avoiding the bad smell inside the mouth, foul smell inside the mouth. Along with that, while brushing time, we actually enhancing the blood circulation of the gums. In that way, we can improve the health status of the teeth also. Firm gums and teeth health also we can improve. Actually, common oral problem. These are all the common oral problems actually we can see among the patient. But in palliative care, majority of the patient having some of these oral problem, xerostomia or dry mouth. In right side, you can see candidiasis, oral candidiasis, or we can call it as a oral thrush. Because of the fungal infection, this oral candidiasis is happening. So this oral candidiasis mainly happening, majority of our palliative care patient also, majority of the cancerous patient during the chemotherapy period or after a long time of chemotherapy period, or maybe because of the unhygienic practice or poor oral care, all together may be the reason for becoming this type of oral candidiasis or oral thrush. Oral thrush actually mild, moderate, and severe level is there. Mild oral thrush means we can do some of the home remedies for taking care. But moderate to severe or severe oral thrush or oral candidiasis happening means they need to continue with some antifungal medicines, maybe oral or maybe intravenous route also. So proper oral care we are giving means we can prevent all those complications or these sufferings we can prevent. Then dry mouth also is happening because maybe severely dehydrated. Already the patient is cannot take adequate water by orally. or maybe according to the use of multiple drugs also, or prolonged usage of some of the medicines also will increase the dryness of the mouth. So it also maybe will be the reason for the dryness of the mouth, and at last it will end up in burning sensation, maybe bleeding and other sufferings also. Then foul smell also, oral cavity having halitosis, foul smell. Then mucositis also, very much severe burning sensation, pain. Patient even at least a sips of water also patient can't take. At that scenarios, everything is happening because of maybe due to the poor oral care. Then who are all needed actually mouth care? Normally one person can do brushing, but who are all needed actually oral care? You can put your answers in chat box also. Which type of patients are all needed oral care or mouth care?
Unconscious patient,
Okay, unconscious patient.
maxillofacial fracture patient,
Okay, fracture or spinal cord injury. According to that, suppose patient is immobilized, means uh, they are needed.
oral
Okay,
cancer patients,
oral cancer patient.
post-oral care surgery patient,
Okay, after the surgery, patient becoming in a resting period, maybe need to immobilize for a while. During that period, patient can't do self care. So those patient needed oral care. Then any other patient? Actually, four category patient we got now, but okay. Thank you for your response, sir. So actually, terminally ill, long term patient is in ill stage only. Maybe condition is deteriorating. Maybe patient is going to end, means end of life stage maybe. So according to that, patient can't take all those things like care we needed to do. Then unconscious patient, already sir told. Then patient breathing through mouth. Majority of the caregiver missing last patient type of patient. Patients on nasogas tube feeding. Actually, they are thinking they are nothing they are giving by orally. Everything they are feeding by the tube only. Even a sips of water also they are not at all giving through the mouth. Then so mouth is almost clean. With any reason, it's not going to unclean. So they are all not at all cleaning the oral cavity. Some caregivers are all practicing like that. But we need to convey the message as like this is a already nasogastric tube already inserted. Majority of the patient taking breath by orally. They are opening their mouth and taking breath by orally. So naturally, atmospheric air containing microorganism, dust particles, everything, it will stick over the or inside the oral cavity. Again, same condition, multiplication of the microorganism, and further complication, it will occur. So proper oral care at least 2 times is very much needed. Even they are feeding by the nasogastric tube means also. Then other already existing oral cancer or oral lesions, oral ulcers, anything is there means also they are all needed. Then post-operative patient also. Then in assessment, as a nurse or as a doctor, whenever we are seeing these type of patient, these type of already we discussed about 6 type of patient. These type of patient, we need to assess any cracked lips or any cotton, curd-like patches, anything is over the tongue or inside the palate, if there is anything is there or not, we need to check. Then in addition to that, if one patient is complaining any burning sensation or pain inside the mouth means we need to look about any ulceration or any oral lesion, is anything is there or not, we need to assess. If one patient is complaining pain means also we need to do the management accordingly for the pain also. We need to do the pain management, then we need to think about the oral care also. Then any dysphagia, swallow difficulties patient is reporting, or anything change in taste of food. Already they are all taking with very much like that food item, but now it's change in taste, or maybe not at all taking. They are all refusing to take same food now, means we need to assess about any link with any drugs they are using, means any medication history along with that is there or not, any unpleasant smell, anything is there or not. All those things we need to assess. Then already I told oral thrush and oral dryness, mucositis. These actually mainly some of the problem mainly facing in the palliative care patient. So we have already told mild type of oral thrush or oral dryness associated with that any burning sensation or pain. Suppose patient is reporting, means we have one home remedy. We can educate to them. Use homemade saline. Actually, it's preparing fine number of water. They can put 1 teaspoon of common salt. They can put sodium chloride. They can put and boil it, cool it very much after cool, and they can store in a clean container. This solution they can use it for gargling after food intake. They can take after food intake, after normal mouth washing. They can use this type of solution for gargling. For cleaning this oral cavity 2 times, 3 times, or 4 times, up to 4 times they can use it, this solution. If they are having oral thrush, means they can add soda bicarb, sodium bicarbonate. They can use it in 500 ml of water. They can put 1/4 teaspoon of baking soda. Then they can mix it very well. If the taste is not liked by the patient, means they can add 1 pinch salt also along with that. Then they can use this solution also for gargling their mouth. So these are all the home remedies we can suggest for the oral thrush or oral candidiasis in mild stage. Along with that, suppose moderate to severe or severe oral thrush, if they are having, means along with the gargling, if it needed, means we can apply mouth pain, cotrimoxazole mouth pain we can suggest. Along with that, any antifungal medicine is needed, means we can start accordingly. Then self-care, actually, if one patient is able to move to the wash basin or to the bathroom for taking care, means we can promote them to do. We need to explain about the importance of the oral care, what are all the benefits it will get, everything we need to convey. Because we can suggest soft toothbrush for brushing. While brushing time, it cleaning the teeth. Along with that, they will get on massaging effect on the gums. So in that way, we can improve the health of the teeth also, we need to convey. If they are using toothpaste, means rinse thoroughly, flush out complete toothpaste from the mouth. Or otherwise, if the toothpaste content is being inside the mouth, means again oral dryness it will increase. So that thing also we need to convey. Adequate water they need to use for rinse out complete the toothpaste from the oral cavity. That thing we need to convey. If they are able to drink water nicely, means advise them to take plenty of fluids for improving the quality of their life and improving the skin health also. Then if again the dryness, oral dryness continuously they are reporting, means one solution is there. If they are wish to take pineapple, means they are liking, means we can suggest pineapple pieces. They can put it inside the mouth and chew. Because it's having some enzyme, it will improve, it will stimulate the salivary gland. So more salivation we can improve by this way. So in that way we can prevent the oral dryness. Or some sore items as like tamarind, anything, if they are wish, means they can use it. It will improve, but it's acidic item. If it any complication or any contraindication according to his health condition is there, means we can't promote, we need to avoid that. Otherwise, if it okay, means we can suggest this solution for the oral dryness. Then if they are dentures they are using, means at night time they need to remove the dentures, or otherwise in between food particles it's accumulating, again the bacterial growth it will happen. So if one patient requires assistance or require one support, then he is or she is okay to do the oral care or brushing. Means we need to explain about the importance and all those things. We need to promote them to do the brushing and all those oral care, but we need to assess and we need to provide and arrange every articles which are all things is needed: brush, toothpaste, then kidney tray or basin, adequate water, for avoiding spillage on the dress and bed. We need to give maybe adequate towel or any other wet draw sheet, anything is there needed, means we can give. So all those things we can arrange to nearby bed, and nearby we can assist them. So then in that way we can promote their oral care by doing themselves with the support. So that thing also we need to give. Then proper comfortable position, semi-fold or fowler position, we can give according to his or her comfort. Then encourage maximum. Here also adequate water we need to provide. In previous condition already they are all near by a wash basin, so there is a water supply is there. But here adequate water we need to provide. Here also again they need to adequate water they need to use and completely rinse out the toothpaste content here also. So indirectly or directly, maybe poor adequate water they are not at all using, means again toothpaste content will be there, again oral dryness it will increase. So that scenario we need to avoid. Then after that, as like every procedure, we need to remove all articles and all those things. Then procedure actually for a terminally ill patient. Suppose one patient is terminally ill, so then we have to take care by using some of the articles. Here actually I am listing in two sets. Hospital setting, what are all the articles? We are all known because we are all using this type of article. But in home care setting, or in home itself, caregiver is doing this type of oral care for the patient, means these are all the items which using in the home care setting also. So these things we need to list, keep in mind as a comparison, because in hospital setting articles, if you are practicing them, means they can't continue because those articles is not available in their home setting. So which are all the things available in the home setting, those items if they are practicing, means, or we can educating them by using these items, means they can continue in their home setting. So about the procedure of a terminally ill patient, we have on video also. So after the video we can come back. And ma'am, actually, can you share the video? Ma'am, am I audible?
I wanted to share video.
Oh, okay, care of
Oral care?
oral care of unconscious patient.
Okay, okay, sir. I'll share just a minute.
Okay.
Sergeant, sir.
Am I audible?
Yeah, sir.
Okay. I think this video is very helpful for you. In this video, some of the equipments we are using, not even practicing in our hospital setting, but we using in this video means maximum helpful for the caregiver. As a part of caregiver education, we can educate these practices to the caregiver. Then only they can continue all those things in their home setting. Because mainly this type of terminally ill or severely unconscious or end of life stage patient means. So after the giving this oral care, we can apply these lubricants. So commonly using liquid paraffin or Vaseline, mainly using. Then in home setting itself, if they have wish means they can use coconut oil or ghee oil. They can use it for us like a moisturizer. So about the care of eyes, actually, we are all know about total head to toe care, but in here actually we need to think about some things, mainly practical side in even this type of unconscious patient being in the stage with neglected care. So in this picture you can see this type of dried form. If they are trying to peel off from the eyelid area means it's again painful and maybe affect like injury and further infection chance also is there. So proper eye care is very much important. So we need to educate them about use multiple strokes for single cotton balls, or if they are using their personal clean towel they are using means one on corner, four corners have, but one on corner for one stroke. In that way, they can clean the eye area. So proper time they need to take care in wet form of cotton ball or this corner of the towel. They can use it for cleaning the eye. While cleaning them from inner canthus to outer canthus direction, they need to clean. All those things we need to convey. Then these complication, further complication chances, what are all things is there if they are neglecting to take care about the eye. All those things we need to explain. Then only they will follow our instruction. Then care of nose and ear means actually in ear for the bedbound patient means majority of the people have the chance to affect like skin peeling or development of the pressure sore in outer ear or ear pinna area. So although while taking care about that area, we need to assess the ear canal also. Then this ear pinna foldings and everything we need to assess, because any accumulation of the sweat and other dirt may be reason for the development of the fungal infection. Any signs is there or not, any color change is there or not, or any chance for development of the pressure sore, anything is there or not, we need to assess. Then ear canal, actually we need to check about the accumulation of wax, anything is there or not. So in starting itself we are clearing everything, and cleaning all those things means we can prevent further complication, as like even hearing problem also we can prevent all those things. So we need to convey as like proper care is needed. Then nose also we need to check, and we need to take care about the nose also. Then actually hair care. Normally one person can go to bathroom and can take bath. At that time itself hair and scalp everything is cleaning. But in this type of bed bound stage patient, in palliative care we are all having follow continuously, we are seeing continuously, we are visiting them. So we know how much the patient, more than the patient, the caregiver is suffering, because in some patient home they are having single caregiver. So with the single caregiver itself they can't shift the patient to the bathroom and take care, as like in bathroom itself they can't wash their head, or even they can't give a bath for the patient. So majority of the patient being in the bed more than months, they are all not at all wetting their head or wetting their hair. So care of hair is very important. As a nurse, we are all know bed itself, how we can take care. All those things we know. But again, we have on video, we can see and come back. Care of hair, ma'am.
Yes, right.
Anisha ma'am, I'll share.
Okay.
So this is hair care, right?
Care of hair, second video.
Sir, you can continue.
Okay, this video also, I think it will be very helpful. As a nurse, we are all know, but I think it's will get us like refreshment. So for this type of bedbound patient, nail care is very important because even majority of the patient in geriatric, in old age type of patient, advanced age patient, even due to the itchiness, if they are just scratching, even that scratch also may will get peeling of the skin. So because their skin is very thin, that scenario also mainly happening. So nail care is very important. If the patient is able to take with the support, if the patient is able to take food, means it's some more problem because accumulation of dirt or microorganism inside the this gap of this fingers means it again more complication for this patient. Then at bedbound stage means also this type of injury chance also is there. So proper nail care is very important. According to our practice, we are all know soaking. If they are having hard nails, means soaking the nail, their finger and hand, dip it in the water for 5 minutes in warm water. They can use it for avoiding the chillness. Then after that, they can cut short their finger nails or toe nails. So that thing we need to convey. Then bed bath, actually we are all know, but we need to convey in some conditions. Majority of this type of terminally ill patient, they are all caregiver practicing by using of wipes. Already in medical store itself, they are all purchasing this type of alcohol wipes and they are all using. But for a short term, for a while, if they are using this type of wipes, means okay, no problem. But for this type of terminally ill patient, continuously they are using this type of wipes, means it's again problem because some more problem again it will happen. So majority of the things we need to convey this type of dryness is we need to avoid. So with the help of normal two bucket system of water and normal soap, they can use it. So how we need to take care according to the alternate use of this type of two buckets of water, then lathers of soap and this type of two towel, usage of two towel, how we can do the bed bath, everything we need to convey to the patient. And the importance also we need to explain to them, or otherwise they will not do. In addition to that, back care also very much important because back care in sideline position, we can give the back care. On that time, we can assess the back area also. Any pressures or sign is there, any color change or any skin peeling or chance is there or not, any over dryness is there or not, we need to assess. Along with that, back care is very much important. After complete giving of sponge bath or bed bath, after that apply moisturizing cream. Mainly we are suggesting petroleum jelly or biolin they can apply and give. They can give gently on mild massage they can give. So we can reinforce the blood supply to the according to that area, because in supine position continuously all those areas getting continuous pressure. So in between we are relieving the pressure and we can by the back care we can give the proper blood supply also again to that all those compressed areas. So all those things also we need to convey to the patient caregiver. So already I told we can prevent the pressure sore by the back care and the proper assessment, and we have some of the preventive methods also. Actually, pressure ulcer or bed sore or other name also decubitus ulcer. So it's actually a localized injury happening on the skin. If it not at all managing or not at all treating well, means some more deep tissues all are affecting. Majority this pressure ulcers chance is there on the bony prominence area or whichever the areas getting continuously getting pressure. All those areas having chance for affecting this type of pressure ulcers. So we have some of the preventive methods is there. Our first of all preventive method is position changing every second hourly. Every 2 hourly, they need to change the position of the patient. If the patient having upper body strength means we can promote them to just hold inside bedside rail is there means inside rail and they can do the shifting to the right lateral, left lateral every second hourly. If the patient is completely dependent or bedbound means how we can change the position, the techniques we need to educate to the caregiver and the importance also we need to explain or otherwise they will not do. Again, the preventive method it's will lose and pressure sore development is there. So that thing we need to convey. Then if one patient is in wheelchair bound, majority of the as a part of the rehabilitation paraplegic type of spinal cord injury patient and as a part of rehabilitation maximum wheelchair to bed and wheelchair bed to wheelchair all those shifting technique and all those things maximum we will teach them because we maximum trying them to independent or maximum reduce the dependency to the caregiver, then only the caregiver can go to the work and earn money and their life need to go on. So at that time, maybe daytime, they most of all they will be in the wheelchair. So in that situation, we can call it as a wheelchair bound patient. So they need to change the position every 15 to 20 minutes. So how they are changing the position every 15 to 20 wheelchair to bed to wheelchair is not possible, not right way. How they can change the position means whichever the area maximum their lower extremities having no sensation, upper body only they are having sensation and strength. So whichever the area continuously getting contact with the wheelchair area, all those areas needed rest in between 15 to 20 minutes. So they need to hold their both hands on the handrest of the wheelchair and just push their lower body from the wheelchair. So it's possible according to improving the hand strength, their upper body strength and upper body their balancing power, how they are improving. According to that only they can hold their complete body weight on their both hands. So that thing truly coming under the rehabilitation physiotherapists or all teaching them. So according to they need to count in their mind 1, 2, 3 according to maximum holding capacity they are achieving in their both hand. Through that time period they can hold their full body in air. So in that way they can prevent this type of continuously getting pressure over the areas mainly for the wheelchair bound areas. Then manage incontinence both bowel and bladder. If suppose on that person is reporting loose stool means we need to assess about the bowel constipation related maybe spurious diarrhea maybe, then do the management for the constipation, then we can stop that type of incontinence. Then bladder incontinence means for every bladder incontinence maybe catheterization is not only the solution. Maybe urology consultation and management may be needed. If it needed means need to do, or otherwise already we have the history. Only the catheterization is the only the management means we can go to the catheterization and they can continue. Then special surfaces like air mattress, water mattress, pillows, or cushion. All those comfortable devices we can suggest to them. But in our society, one they're thinking if they are placing this patient on the air mattress or on the water mattress means through that way they can prevent this type of pressure sore. So we need to convey the point. These airbed or water mattress, all those things is not a preventive method. It's a comfortable device. It will reduce the risk of development of the pressure sore. That's only. So if they are placing the patient in airbed, water bed, or normal mattress, wherever means also they need to change the position every second hourly. That thing we need to convey to them. Otherwise, they will not follow that. Then in some conditions, some caregivers are making lie the patients on directly on the airbed or directly on the alpha bed. That also not a good practice because Anyway, it's not a skin-friendly material. So cotton type of bed sheet is mandatory on the airbed or on the water bed. Then only they can lie down this patient over that. That thing we need to convey. Then proper nutrition and hydration is very much important. If they are able to take orally nicely, means we can promote them to take more nutritious food and hydration, more plenty of water intake also we can improve. Then as a part of the back care, also again massaging with the help of liquid paraffin or white petroleum jelly. In our center, actually, we are suggesting because comparatively it is cheaper and the moisturizing effect also it will last more than other costly moisturizing items. So that thing also we will convey. Then wrinkle-free bed is very, very important. We are conveying them to maximum wrinkle-free bed. We making them to do because if they are lying in the wrinkled bed means according to the friction type of shear force related pressure injury, pressure sore, the chance is there. Then proper nail care also very much important. Even a small scratch also will develop further development of the more pressure sore development chance is there. So these are all the preventive methods of the pressure sore. So it's having a short form SSKIN. First S is the supporting surface, airbed, usage of airbed, waterbed, or the cushions and other pillows, all those things. Then inspection of the skin and the back care, all those things is coming under that. Then keep moving, position changing every second hourly. Then manage the bowel and bladder incontinence accordingly. Then proper nutrition and fluid intake, hydration also very, very important. This is the short form. Then exercise. Actually, for a bed-bound stage or bedridden patient, actually physiotherapy is needed. We needed to in between doing this exercise, and why we need to make them more suffer? Is it needed actually? Normally, the exercise here we doing not for making them to lie from bed and making them to walk and making them to do all those activities. Not that is our intention. Maximum active and passive exercise, at least range of motion exercise only is needed because we need to avoid the complications as like muscle contracture, then joint muscle and joint stiffness, all those things, then foot drop, wrist drop, all these complications we need to avoid because these are also it will affect the quality of life of the person or quality of life of the patient. So those scenarios we need to avoid. So for that point of view, we need to do some of the active and passive exercise. If the patient is able to do means we can teach them, we can promote them to do all this exercise. If it not possible means we can teach the caregiver passively, they can do this type of exercise. Maximum we are trying them to maximum mobilize moving joints. Every moving joint at least 2 times, morning and evening, they can move, and we through that way we can prevent all those complications. Then contracts, all those things we can prevent. Then we moving to the catheterization. Here we not at all going to discuss about the catheterization procedure, but in this slide I am pointing out some of the bad practices following by the caregiver without their knowledge only. Some mistakes they are doing, so that thing we need to convey to them. So type of catheterization, everything we are all know. Indwelling catheter, in indwelling itself, ureterally and suprapubically is there. Then intermittent clean catheterization as a part of rehabilitation. Mainly from indwelling, we are all shifting to the intermittent clean catheterization. For a male person means if their complaint is not at all urinary retention, but only the urinary hesitancy means we are all putting urocondom. All those things we know. But in this itself, we need to keep in mind and we need to convey some message to the patient. If in our setting also some of the patient scenario we just seen, if one male patient using urocondom, we need to tell to them in daily 2 times. They need to remove the urocondom from the penis and need to give proper care to the penis after removing the foreskin. All those things we need to convey, because in our setting also we just seen 2 to 3 patients. They not at all change the urocondom for 3 to 4 days. So 3 to 4 days continuously in the urine, as like in this pouch of this urocondom, the penis is dipped in the urine and the ulcer is developed. So very painful. Further, urocondom we can't apply because already ulcer is there. Then catheterization, they are actually catheterization, indwelling catheter, not at all needed, but we needed to do. So unwanted entering of microorganisms also. So all these complications happening because of neglecting of the care. So if we are using this type of urocondom for the person, means we need to convey the message. They need to take care the area as like the perineal care. They need to change the urocondom, wash it this urocondom. Alternatively, they can use it this type of urocondom. In addition to that, we need to convey multiple times they can use same urocondom after washing with the help of soap and water. So they need to dry this urocondom under the shade only, not on under the directly under the sunlight, because cracks and holes it will develop. So they can't use multiple use. They can't use this type of urocondom. So that thing we need to convey, or otherwise again financial burden it will happen to the family. So proper care of the urocondom and proper care of the perineal area, both are we need to explain to them. Then indwelling catheter already is there, means some of the mistakes caregiver is doing, means in some cases they are all keeping the uro bag on the bed itself, in between the leg they are all placing. In some other areas they are all not at all fixing, supporting the Foley's catheter bifurcation area on the thigh region is freely hanging, or otherwise in some situation the outlet of the euro bag just keeping it open. So all those practices some caregivers are all following. In other things, more than maybe more than 1.5 liter, more than 3/4 level of the euro bag is filled with urine, means also they are all not at all emptying. So these practices are all problem. So we need to maximum educate to them, as maximum hang the euro bag below the waist level of the person, to the underside of the bed they need to hang, because we need to convey there is no pumping activity. According to the natural gravitation force only, the pooled urine inside the bladder is coming through the tube and to the euro bag. So a natural thing need to happen. So we need to convey, or otherwise the retention it will occur, and again the UTI, recurrent UTI chance is there. We need to convey to them. Then proper support of this bifurcation of the area of the Foley's catheter on the thigh region, or otherwise any accidental pull is happening, means directly the pull is happening inside the bladder, and further injury and the bleeding and other complication chance is there. We need to convey to them. Then outlet of the uro bag need to remain its closed after draining out the urine, or otherwise already the urine is a waste material only, microorganism is there. In addition to that, atmospheric air containing microorganisms also, it will enter through the outlet and it will enter inside the bag, and again it may be the reason for the development of the bacteria. So chronic prolonged usage of bacteria, this prolonged usage of catheter associated UTI chance is there for every catheter using person. In addition to that, neglecting of this type of closing and all those care, means again further development of the microorganism is happening. So unknowingly we only or caregiver only maximum trying to make further UTI. So because of their knowledge deficit only, we need to convey this point to them. Then only they can practice all those things. Then proper perineal care also. Both the male and female patient, proper perineal care is very important. We need to convey to them, for male and for female, both of them. For male means just foreskin, they remove the foreskin, and in female patient means spreading visibly, normally visibly the vulval area, and complete thorough cleaning is very, very important. In addition to that, one more thing we need to convey, these type of bed-bound chronic catheterized patient, whichever the time, whenever the defecating is or the stool is passing, at that time they need to clean the rectal area. Along with that, they need to clean the perineal area for both male and female. Along with the catheter also, they need to clean. Or otherwise, the fecal matter it will accumulate on the catheter. Again, the chance for affecting the UTI. So all those things we need to convey to the patient's caregiver. Then bowel care. Actually, the constipation we need to prevent. If the patient is able to nicely orally nicely means we can promote them to take more fiber rich diet and fluid intake we can promote. Through that way we can prevent the constipation. If already existing constipation is there means oral laxatives or any other management as like PRE, enema and usage of suppository is anything is there is needed means we can maximum promote. Or laxatives also at any point it's needed. If you are feeling to need means we need to start the oral laxatives tablet or the syrup form we need to start. If once the constipation history is there more than 2 means in 2-day constipation means do the PRE according to the finding. If the loaded rectum with the hard stool means we need to do the manual rectal evacuation or DRE we need to do. In addition to that, we can apply the Dunkel suppository. If balloony rectum is means we needed to give high sodium phosphate enema may be needed. According to that, according to the PRE finding, do the management for the constipation. Then nasogastric tube feeding, actually here also some of the mistakes patient caregiver side is happening. So nasogastric, or in first slide oral care itself I already explained. In nasogastric tube feeding, everything caregiver is feeding through the tube, not by the orally. So they are neglecting the oral care. That thing we need to convey, or otherwise they will not do the so that thing we need to convey, or otherwise they will neglect about the oral care. So importance of oral care, even they are feeding by the rice tube also we need to convey. Some of the mistakes the caregiver doing in the side of nasogastric tube means they are all making the patient from supine position to the semi-fowler or fowler position, make them to elevate the head end. Then they are going to the kitchen and taking the food items, other items. Then actually they are trying to arrange the articles. So some of the history is there. After making from lie down to the semi-fowler or fowler position, they are leaving from the patient. Accidentally, the fall risk is very high for this patient, because some of the patient, the changing position from supine to suddenly from supine to semi-fowler may be feeling of giddiness, vertigo also the chance is there associated with the fall history is there, fall risk also is very high. So maximum we need to convey, maximum they need to keep it ready, everything nearby the patient, then make the position change from the supine to the semi-fowler. Then they can start the feeding. Some mistakes also, they are not at all pinching or folding the tip of the rails tube for preventing the air entry. That mistake they are all doing. So we need to educate with even a single step itself. We need to convey the message, and the further complication also we need to explain. Otherwise, they will maybe they will leave that step. So that thing we need to convey. Then for every person, the feeding quantity not be the same. In palliative care patient, maybe end of life or the condition is deteriorating, their activity is very much low. In all those situations, maybe the feeding we need to limit as like 150 to 200 ml once in a 3 hour, like that. But maybe some actively management is there means according to the dietitian or according to the prescription of the doctor, we can feed. But mainly in the palliative care, the feeding quantity need to be low, as like 150 to 200 before and after flushing of the tube by using 25 ml of plain water before and after feeding. All those points we need to convey. Along with that, we need to convey to them maximum maintain the position, semi-polar position 20 to 30 minutes after the feeding also. That thing also we need to convey, or otherwise they soon after the feeding, they will make flat to the patient to the supine position. So the aspiration pneumonia chance is there. So that risk factor also we need to explain, or otherwise they will leave that step. In addition to that, periodically they need to remove the fixation on the nose tip in between, or otherwise it also may be the reason for the development of the skin peeling and the pressure sore development chance is there, and maybe skin excoriation also may will happen over the area. So we need to convey periodically. They need to change the adhesive tape from the nose tip and clean it, and proper care is needed. After that, they can fix it with a new adhesive tape. So with itself, I am winding out this session. I'm completing the session. Our message: there is no situation. We have some limitation is there for making cure from the disease condition. So the diagnosis may be CLM, or the diagnosis may be another thing. There is so much limitation is there. As like we need to take care, how we can take care as like a curative side. There is so much limitation is there in the part of the curative side, but there is no limitation for care, and maximum we are trying to give comfort to the patient, improve the quality of life and maintain the quality of life. As a part, there is no limitation for us. Basically, as like nurses, we have no limitation. That thing we need to keep in mind, not only for the nurses, as a part of caregiver, they are all acting as like nurses in their home setting. So these messages we need to convey to them, we maximum educate to them.
Dear participants, if you have any doubts, please ask. Sir is here with us.
So I think most of the participants having some network issues. It's very less participants here.
Here we have a lot of network issues today.
They're from Ladakh, so they are facing some network issues. So I have very less participants here. So dear participants, kindly ask your doubts. Sir is with us. So it seems to be simple, but this is a major part of in palliative care. So I think the session is clear.
Thank you so much, sir.
Thank you, sir. Thank you for the session, and the videos are very
Thank you.
useful.
It's
Yes,
very
sir.
informative session.
Yes, sir. So can we wrap it up for today?
Okay, sir.
So okay. So I'll let you know, Dharmendra, Mr. Dharmendra. I think we have 7 more sessions to go. So okay, so you can leave now. Thank you for participating. Thank you, Anisha ma'am.